It's funny, like, we all know our kidneys are essential, but I bet most people couldn't tell you much about them.
Right.
We got a ton of research requests on renal cysts, and
Yeah.
honestly, before I actually dug in, I kind of thought they were, like, super rare.
Mm-hmm.
Turns out, not so much. What surprised you the most about them so far?
Well, I was surprised too how common they actually are.
Oh, yeah.
Think about it. Over half the folks over 50 have at least one.
Really?
And most of the time, they don't even know.
Wow.
Yeah, simple cysts, these little fluid-filled sacs,
Mm-hmm.
they're usually totally harmless.
So my kidneys could be rocking these little sacks right now, and I'd have no clue.
Yep.
That's both wild and makes me kind of want to schedule an ultrasound, like, right now.
What?
But
Yeah.
why are they so common, especially as we age?
It's a good question. Part of it might just be time, Like,
Yeah.
as we get older, our kidneys just have more time to develop these little pockets,
Mm,
kind of like wrinkles, I guess.
exactly.
Plus, the walls of those tiny tubes in our kidneys, those can weaken with age too,
Right.
makes them more likely to form cysts. And speaking of those tubes, it's important to know those simple cysts usually form from these outward pouches.
Okay.
So they're not actually blocking the flow of urine. That's part of why they're usually not a big deal.
Gotcha. So they're like little detours, not roadblocks.
Exactly.
Okay. But you mentioned complex cysts, too. Those sound a bit more worrisome.
Right. Complex cysts are the ones that sometimes, can signal a problem.
Hmm.
Imagine a simple cyst, but with thicker walls,
Okay.
maybe some dividers inside, or even some solid bits.
Oh, wow.
Those solid components can be anything from calcium deposits to scar tissue,
Hmm.
and in rare cases, even cancerous cells. So doctors pay closer attention to those.
That makes sense why they'd be more concerned about those. So besides age, what else might make someone more likely to get either type?
Well, high blood pressure, for one,
Okay.
puts a lot of strain on those tiny blood vessels in the kidneys.
Yeah.
And that might play a role.
Mm-hmm.
If someone has chronic kidney disease or they've been on dialysis for a long time, their kidneys are already working overtime.
Right.
So that could increase the risk too.
Makes sense.
And then there's genetics, of course. Some conditions like polycystic kidney disease or PKD
Right.
that's inherited and causes multiple cysts.
So it's this whole mix, age, lifestyle, genes, all playing a part. Now, if someone doesn't have any symptoms, how would they even know they have a cyst?
Yeah.
Is it something that shows up in blood work?
Sadly, no.
Hmm.
Most renal cysts are silent. No noticeable symptoms.
Oh, okay.
Unless they get large enough to press on other organs or they become infected.
Mm-hmm.
And they don't typically show up on those routine blood tests either.
Gotcha.
Usually they're found by accident, like during an ultrasound or CT scan that was ordered for something else entirely.
So it's really only if they cause trouble or are found by chance.
Mhm.
Speaking of trouble,
Yeah.
what are the signs a cyst needs attention?
Well, keep in mind, most folks with simple cysts never have any issues at all.
Okay, that's good.
But if you start having pain, like in your side or back,
Uh-huh.
especially a dull, achy pain that comes and goes,
Yeah.
that could be a sign it's pressing on something.
Hmm.
Also, if you're suddenly needing to pee more often, see blood in your urine, or get a fever,
Oh, wow.
those are red flags.
Yeah.
Especially the fever. That often means there's an infection.
Okay. Those would definitely send me straight to the doctor. I'm guessing imaging tests are the next step.
Exactly.
Mm.
An ultrasound is usually the first thing they'll do. It's quick, painless,
Yeah.
gives a good picture of what's going on.
Okay.
If the ultrasound shows something suspicious,
All right.
the doctor might order a CT scan for a more detailed look.
Gotcha.
And sometimes, especially for those complex cysts, an MRI is used. Get even more precise images and rule out other things.
So it's like detective work,
It is.
using different tools to figure out what's going on. Now let's talk treatment.
Okay.
What happens once a cyst is diagnosed? Does everyone need surgery?
Thankfully, no.
Okay, good.
That's the good news, especially for simple cysts.
Mm.
Most of them don't need any intervention at all.
Wow, really?
Yeah, doctors usually just keep an eye on them, maybe with a follow-up ultrasound every so often,
Okay.
just to make sure they're not growing rapidly or causing any problems.
So it's not a one and done, but more of a let's watch and see approach?
Exactly.
Okay. But what about those cases where treatment is needed? What are the options?
Well, for cysts that are causing pain or getting too large,
Mm-hmm.
doctors can do a procedure called aspiration and sclerotherapy.
Okay.
Basically, they use a needle to drain the fluid from the cyst.
Mm.
Then they inject a solution that helps to collapse it, and prevents it from refilling.
Oh, so they kind of deflate it from the inside.
Exactly.
Clever. What about those more complex cysts, or if that doesn't work?
Right.
Is surgery the only other option?
It's definitely an option, but it's usually reserved for the more complicated cases.
Okay.
Like if a cyst is blocking urine flow, causing infections over and over, or shows signs of, maybe being cancerous,
Right.
then surgery to remove it might be the best course of action.
So weigh in the risks and benefits for each case.
Yep.
We've talked a lot about simple cysts and complex cysts, but what about polycystic kidney disease? How's that handled differently?
PKD is a bit more complex because it's a genetic condition that causes multiple cysts to develop over time.
Mm-hmm.
Unfortunately, there's no cure for PKD, so treatment focuses on managing the symptoms, slowing down kidney damage,
Right.
and maintaining kidney function as long as possible.
So a more long-term strategy.
Yeah.
Now, we've covered causes, symptoms, diagnoses, even treatment, but the real question is, can we do anything to prevent them in the first place?
Well, you can't always prevent renal cysts, especially when genetics are involved.
Right.
But there are definitely things you can do to support your overall kidney health, which might help lower your risk.
All right, spill it. What are these magical kidney boosting tips?
Well, the first one is something we all know but don't always do enough: hydration.
Oh, yeah.
Drinking plenty of water is crucial for your kidneys to function properly. Think of it this way. Your kidneys are like filters that are constantly cleaning your blood, removing waste products and excess fluids.
Okay.
And for those filters to work right, they need a steady supply of water to flush everything out.
I am guilty of not always getting enough water, I'll admit. I reach for coffee first thing in the morning. How much water should we aim for? Is there a magic number?
There's no one-size-fits-all answer. Everyone's a bit different.
Right.
But a good general rule is at least 8 glasses of water a day.
Okay.
And here's a tip. If your urine is pale yellow or clear, that's a good sign you're well hydrated. If it's darker yellow, drink more.
All right. I'm definitely going to be paying closer attention to that.
Good.
What else can we do?
Another important factor is diet. What you eat plays a big role in kidney health.
Makes sense.
Try to limit processed foods. They're often loaded with sodium and additives that can stress your kidneys.
So opt for fresh, whole foods whenever possible.
Exactly.
Give me all the fruits and veggies.
Yes. Along those lines, keep an eye on your salt intake.
Salt. Okay.
Too much salt can lead to high blood pressure, which we know can damage those delicate blood vessels in your kidneys.
So it's a double whammy. High blood pressure is bad for the heart and the kidneys.
That's right.
What else should we be mindful of?
2 other biggies are smoking and alcohol.
Okay, yeah.
Smoking damages blood vessels throughout your body, including in your kidneys,
Right.
and too much alcohol can put a strain on them as well.
So a lot of this overlaps with general healthy lifestyle recommendations. It's amazing how those habits can benefit so many different parts of our bodies.
It really is. It's all interconnected.
Yeah.
And while we can't completely eliminate the risk of renal cysts, taking care of our overall health, including our kidneys, goes a long way.
Absolutely. Okay, so we've learned what renal cysts are, what causes them, how they're diagnosed, and how they're managed. But the biggest takeaway so far seems to be that while they can be a cause for concern, most of the time, they're nothing to worry about.
That's a great way to put it. That's right.
Yeah.
Most people with renal cysts live perfectly normal lives, never have any problems.
That is reassuring to hear. But, it struck me as we've been talking, this deep dive into renal cysts has actually revealed something much bigger.
What's that?
The way our bodies are all connected.
Absolutely. It is fascinating how something that seems like an isolated issue, these little sacs in our kidneys,
Right.
can actually be affected by so many things.
Yeah.
Our blood pressure, what we eat, even our genes.
It's like a domino effect. One thing can impact another, and then suddenly you're dealing with a whole cascade of events. And that makes me think, knowing what we know now about renal cysts, what's the big takeaway for our listeners?
I think the biggest takeaway is understanding our own bodies and being proactive about our health. We've talked about how most simple cysts are harmless,
Right.
but even those need to be monitored.
Yeah.
And just knowing what to look for, those potential warning signs, that can make a huge difference.
It's like being an informed advocate for your own health, You're not just passively waiting for something to go wrong.
Right.
You're actively paying attention.
Exactly.
And taking steps to stay healthy.
And the second big takeaway is a lot of the things we do to prevent or manage renal cysts are things that just benefit our overall health anyway.
It's true.
Eating a balanced diet, staying hydrated, managing our blood pressure, not smoking.
Right. All the good stuff.
All that contributes to a healthier life.
It's a win-win. You're supporting your kidneys and boosting your overall well-being at the same time. But, as we've been discussing all these lifestyle factors, I've been wondering, what about stress?
Oh, that's interesting.
Does stress play a role in kidney health or even cyst formation?
Hmm. That's a really interesting question, and it's one that researchers are still looking into.
Yeah,
We know chronic stress is bad for our health in general, contributes to inflammation,
right.
hormonal imbalances, and those things can affect different organs,
Mm-hmm.
including the kidneys. Now, there's no direct link that's been proven between stress and renal cyst formation,
Okay.
but managing stress through things like exercise, mindfulness, and getting enough sleep can definitely contribute to better overall health, which is always a good thing.
So, while the jury might still be out on the direct link between stress and cysts, it's safe to say that reducing stress is beneficial for us in countless ways. Okay, so we've armed our listener with a ton of information about renal cysts, but where do they go from here? What's the next step for someone who wants to learn more or maybe address any concerns they might have?
Well, the most important next step is talking to their doctor. This deep dive has given them some great information, but everybody's different, right?
Right.
And a doctor can give personalized advice, order any tests they need, and really address any specific concerns based on their medical history.
Yeah, that makes sense. It's about taking this general knowledge and applying it to their own personal health journey. And speaking of that journey, I think what's really struck me throughout this whole conversation is the incredible resilience of the human body.
Oh, it really is remarkable.
Yeah.
Think about it. Our kidneys are constantly working, filtering our blood, removing waste,
Yeah.
regulating fluids.
All day, every day.
And they do all this while being bombarded with all sorts of challenges,
Yeah.
from, well, not eating the best to environmental toxins.
Right.
And yet they keep going day after day.
Without us even really thinking about it.
It makes you appreciate those little bean-shaped organs, doesn't it?
It really does. And while this deep dive has focused on renal cysts, it's a good reminder to be proactive about kidney health overall,
Absolutely.
right? Even if you're not in that over 50 age group where cysts are more common, there are still things you can do to keep your kidneys healthy for years to come.
Exactly. Regular checkups with your doctor, healthy habits, and staying informed about your own health are key.
I love that. What a perfect note to end on. We've learned so much about renal cysts today, but even more importantly, about how much power we have to take control of our own health
That's right.
and make choices that support our well-being. It really is. It's like we have this incredible power within us. As we wrap up this deep dive, I'm wondering what's one thing, like just one, that our listener could do today to start supporting their kidney health, even if they've never even thought about their kidneys before.
If I had to choose just one, I'd say become more mindful of their fluid intake. We often just go about our day, without paying much attention to how much we're actually drinking.
Oh, yeah. You're telling me I'm a big coffee and tea drinker. Gotta have my caffeine. And I'll admit, plain water does sometimes feel a bit, well, boring.
It's true.
Hmm.
But remember, hydration doesn't have to mean only plain water.
Oh, good point.
Herbal teas,
Right.
water infused with fruits or veggies, even broth-based soups, those all count towards your fluid intake.
That's true. I love making cucumber and mint-infused water in the summer. It's so refreshing.
Sounds delicious.
But I also know myself, when I get busy, I just completely forget to drink anything. Are there any strategies for remembering to stay hydrated throughout the day?
Oh, for sure. Some people keep a water bottle with them all the time
Yeah, I see those everywhere.
and set reminders on their phone to drink.
Mm.
Others like to link drinking water to certain habits, like having a glass before each meal or after they go to the bathroom.
I like that. It's all about finding what works for you and making it a habit. And what's cool is that by focusing on hydration, we're not just helping our kidneys.
Right.
We're benefiting our whole body, right?
Exactly. Staying hydrated keeps our skin looking good, our joints moving smoothly,
Mm.
and it even helps regulate our body temperature and digestion. It's like the ultimate multitasker.
So there you have it, folks. If you want to show your kidneys some love today, grab that glass of water, whip up some infused water, or enjoy a nice cup of herbal tea. Your kidneys will be doing a happy dance.
They sure will. And remember, while we've spent this deep dive talking about renal cysts,
Right.
those principles of taking care of your kidney health, they apply to everybody.
Absolutely.
So be proactive, chat with your doctor, and embrace those healthy habits.
Yeah.
Your kidneys will thank you.
What an incredible journey this has been. We've learned so much about renal cysts, from how they formed to the practical steps we can take to keep those kidneys healthy. And it's really been driven home just how interconnected our bodies truly are. Taking care of one part benefits the whole. Thank you for joining us on this exploration. Remember, knowledge is power. Use it wisely, take care of yourselves, and keep those kidneys happy.